Cancer Podcast. And what we're going to accomplish in this episode is to do a quick rundown on the basic terminology and essentially a quick tutorial on the way that brain tumors are categorized and cataloged, as well as some of the symptoms that you may be experiencing prior to being diagnosed with a brain tumor. But before we get going, I wanted to say thank you for joining me on episode number 2. And this is only meant to be a quick rundown, and I hope to dedicate more episodes in the future to more detailed discussions on some of the things we're going to talk about. I just want this episode to be an easy listen for anybody that may have just been diagnosed or has a family member that has been diagnosed. So we're all familiar with the basic concept of cancer in that it's abnormal cells that are growing out of control, and the normal brakes that are on a cell to stop it from dividing over and over again have been removed, and it's usually as a result of DNA damage and mutations. When you look at cancer in the brain, though, it's not as easy as a benign and a malignant tumor, because even though the lowest grade tumor is considered benign, which is non-cancerous, it doesn't mean that it's not growing and putting pressure on an important part of the brain, like the brainstem. So even that still has to be followed up on. So it's important to know that there's not really anything known as a benign brain tumor. I have a few pages pulled up here, so I'll be referencing from the ABTA website and Johns Hopkins. So I have a couple different things to talk about. All I know is that I really need to get a second monitor so I can put all of this on a second screen as well. So according to the World Health Organization, we have 4 different grades of brain tumors. Each tumor is graded based off of what the cells actually look like under a microscope and how aggressively they are dividing. So we have grades 1 through 4, with a grade 1 being almost completely in children. So a grade 1 is called a pilocytic astrocytoma, and they are slow growing and they have well-defined borders. And these are most common in children and teens, and they only account for 2% of all brain tumors. And they can be removed with surgery, and there's always the option for chemo and radiation if there is any growth noted, because these can progress into a higher grade tumor, so it needs to be monitored. Grade 2 is where you start to get to the more aggressive types of cancer cells. Grade 2 is a low-grade astrocytoma, and your astrocytes are the star-shaped cells that support your nerve cells in your brain. And these are also slow-growing. As common with brain cancers, they rarely spread to other parts of your body, whereas other cancers can metastasize or spread into your brain, and those are known as secondary brain tumors. Brain tumors that are referred to as primary brain tumors form in the brain, and they rarely will spread outside of your central nervous system. It has happened, but it's very rare. And the grade 2s don't have well-defined borders, and it's also possible to remove these with surgery if it's safe, along with radiation and chemotherapy. Grade 3s are known as anaplastic astrocytomas, and they also form from your astrocytes, and these grow much more aggressively and faster than a grade 2, and these cells, they don't look the same under a microscope, and this is when they start to invade the surrounding tissue inside of your brain, and these are also more common in men than women. Grade 3 tumors are malignant tumors, and they are actively reproducing cancerous cells, and it spreads quickly into nearby parts of the brain. Even through resection and chemotherapy and radiation, they tend to come back often as a higher grade tumor, which is the one we're about to talk about. A grade 4 tumor is a glioblastoma, and it is the most malignant. It grows very quickly, and it forms tentacle-like fingers that will spread into the normal, healthy parts of the brain which makes surgery very, very difficult. And they are very abnormal under a microscope. And they form blood vessels to keep their growth going. And they also will have areas of dead cells in their center. So these are actively spreading in your brain to try and keep growing and spread all the way through the brain. And it's very difficult to determine what grade a tumor is based off of just like a CT scan. And it is very possible for one tumor to grow into a higher grade, or after it's been removed, to come back as a higher grade, such as a glioblastoma. All right, so now that we know the 4 grades of brain tumors, what is the usual standard treatment? Well, if possible, full resection combined with radiation therapy and chemotherapy if it's something that may be of benefit to the patient. Surgery can often be difficult because of the higher grades' ability to spread into normal healthy tissue, which makes it very difficult for a surgeon to remove all of the cancerous cells and leave the healthy cells in the brain untouched. And because of the fact that it's very difficult to remove all of the cancerous cells at once, that's why radiation is often used as a treatment after about 4 weeks, when the patient has recovered enough that they can start the therapy combined with chemotherapy oftentimes. Prior to starting radiation, you will also be fitted with a one-of-a-kind mask that you get to wear every time you lie down on the table for your radiation. If you would like, you can keep it once your treatment is all done. I still have mine, and many people still have theirs and have decorated them and turned them into pieces of art as a way to remember their battle and their fight against brain cancer. And as far as chemo goes, the most common form is Temodar or temozolomide, which is an alkylating agent which targets the guanine molecules in the cancer cells, and the purpose is to damage the DNA so that the cell will essentially kill itself, which is known as apoptosis, and it will send it into a death spiral. So you'll hear the term standard of care, or SOC, which is referring to the trifecta of surgery, radiation, and chemotherapy. After your initial radiation is done, you get 4 weeks off with no chemo, and then you'll go on what is known as the 5-23 cycle, which consists of 5 days on a higher dose of temozolomide and then 23 off. And this is where it can be more fatiguing and more sickness can occur, even though temozolomide is much more well tolerated than other forms of chemo. It's an oral chemo, so you can take it at home, and you'll be receiving it at a dose close to 3 times what you were taking during your radiation. And you'll stay on this for 6 months, and then you'll be reassessed by your oncologist afterwards. So some other terms that you may hear, or you should ask your doctor about, are the MGMT methylation status and the IDH1 mutation status of your tumor, because these will guide how effective the chemo will actually be. Methylated tumors respond better to the temozolomide than unmethylated patients, because the unmethylated patients, like myself, what it essentially does is when the Temodar binds to the guanine molecule in the DNA, what will happen is the cancer cell will actually be able to kick the Temodar off of the guanine molecule and make the chemotherapy much less effective. So if you are unmethylated, you will probably not receive as much of a benefit for chemotherapy. And being able to enroll in a potential clinical trial is another really good option. The IDH1 mutation is also very important in long-term prognosis for brain cancer. There's still a lot we don't know about the IDH1 mutation, but it is generally associated with tumors of the frontal lobe, and approximately 70% of IDH mutated gliomas are located there. So that is the case of mine. I had a right frontal glioblastoma with the IDH1 mutation, and it was unmethylated. So that qualified me for an immunotherapy clinical trial because traditional Temodar wouldn't be as effective. So you'll definitely want to ask your doctor about the IDH1 status. There is an IDH2 mutation as well, but it is much more rare, but it has the same better prognosis in tumor patients. So if we start at the beginning, what are the symptoms of a brain tumor? Well, there are many, and I've experienced more than a few of them. One of the most common is headaches. And these aren't your typical headaches. These are headaches which don't go away, and your typical like ibuprofen, Tylenol, they don't help at all. Usually the cause of these headaches, it's the pressure from the tumor pushing against, sensitive parts of your brain, and this is what can cause some of the other symptoms, because wherever the tumor is at, that's generally the area of your body that it's going to affect. And just because you have a headache does not mean that you have a brain tumor, but if you look at the whole of these symptoms, you may want to speak with a doctor. I know people that have been initially misdiagnosed by their doctors who didn't put all of the symptoms together and didn't even consider the possibility of a brain tumor. And something like that can be literally life-threatening for that person. The person might also experience memory loss. I certainly had that in 2016 because I don't remember much of that entire month of September. I don't know how I got places, which is really scary, and I don't know how the furniture ended up in our apartment. When I came home from the hospital, I had no idea how that furniture was in there. And even though I had slept there for a few nights prior to going into the hospital, that is, I don't remember anything. There are a lot of emotional things which may manifest themselves as a result of a tumor pushing on parts of your brain, such as personality changes. I had that too. I became a completely different person, something that I look back on and realize that I said a lot of mean things to a lot of people, and even though I apologized to them all after I had gotten out of the hospital and then got back to work, it's hard getting past some of the things that I said. And even though we all know that it was the tumor talking, not me, you still can't help but feel bad. This can also be accompanied by mood swings, which I definitely had that. I was much more quick to turn to anger, I guess it was. I didn't really experience the other swings and frustration due to not being able to properly express myself, and I was having a loss for words, which for me is kind of rare. And aside from emotional things, you can have a lot of cognitive issues like speech. Your ability to reason is compromised, your judgment is not great, and even the ability to correlate cause and effect. These behavior changes are usually the result of a tumor being in the frontal, temporal, or parietal lobes, while your motor functions are generally near the rear of your brain, near the brainstem. Fatigue is another symptom which could come on slowly, but you will notice that you get tired a lot easier, and even just going about your normal daily routine starts to become a chore. Some of the most severe changes which can indicate that you may have a brain tumor are vomiting, and the worst of all would be the seizures, and they can be focal, which means specific to a certain part of your body, or they can be full-on seizures. I had much more focal symptoms because my hands were shaking and then my legs just didn't work. They were completely paralyzed. I had no ability to walk, and combined with my hands shaking, it was clear that something was not right in my brain. And most of these symptoms are all related to where the tumor is inside your brain, because as we know, different areas of your brain control different aspects of your body, which furthers the idea that there is no such thing as a benign brain tumor, because there should never be anything else growing in your brain because it's taking up space reserved for actual brain matter. So now that we've identified some of the symptoms that you may have had and identified the 4 grades of brain tumors and gone over a basic overview of the standard of care, along with some of the specific mutations to look for, I think that we can move on in future episodes towards giving a thorough breakdown on each of these. This was just meant to be a quick listen and to give you some things to possibly write down and ask your doctor about. So I would definitely ask them for the genetic profiles. And one final thing, clinical trials. This is good for everybody, whether you are a new patient or potentially a recurrent brain tumor. Because the standard of care hasn't really changed over the past 30 years, other than the addition of Temodar, there hasn't really been much progress in what would be considered a standard treatment for, in my case, glioblastoma. So clinical trials are definitely something to look into. You can go to clinicaltrials.gov and find whatever. You can type in your type of cancer, and it will show you whatever trials are currently recruiting or have already been completed, and you can look at their results as well. There have been a lot of promising new treatments, especially in immunotherapy, which is using your body's own immune system to target the cancer cells in your brain and be able to fight them on that front, combined with the radiation to kill any remaining cells and after your surgery. Probably the biggest game changer in recent years is the Optune device, which is now it's FDA approved. It went through trials the past few years. It uses alternating electric fields to disrupt the cell division going on inside of a tumor. So it's basically a cap that you have to shave your head every couple days and reapply these pads, and it wraps all the way around your head, and you have to wear it for 18 hours a day, and it has to be recharged. It has pretty hefty battery to it, but it is portable, and many people have had great success with it, and there are many stories of people on it right now that probably wouldn't even be here now if not for something like this. So that is also a possibility. It is a lot of work because you have to either shave your head every day or have somebody else shave your head. But that has been the most recent example of something that has been approved by the FDA for treating various brain tumors, especially glioblastoma and other astrocytomas. So I think that about does it for this episode, and I wanted to say thank you for listening, and I'm still getting the hang of this, and I'm still a little bit nervous, but I'm trying to get into the mode where I can just sit down and start talking. It takes me, a little bit, but I think I'm getting there, and once I edit this, I'll try and get it posted. I'll give it a listen, and hopefully it sounds all right. So you can follow me on Twitter at Brain Cancer Pod, and you can visit the website at braincancerpodcast.com. I'm still currently in the process of updating it. I just have been quite busy with work and trying to record this episode. You can also like the page on Facebook. It is Brain Cancer Podcast, and be sure to subscribe on iTunes, Spotify, Stitcher, wherever you get your podcast from. It should be there. And I just wanted to say thank you guys so much for listening. And please email me with any suggestions. You can tweet at me. Email is braincancerpodcast@gmail.com. So I'm not hard to get in contact with. If you have any stories that you want to send me, ideas, suggestions, or if you want to come on the show and tell your story, we can chat via Discord or Skype or whatever is most convenient for you. Or if you want to send me an email with whatever your story may be, I will gladly read it for the show. So feel free to contact me. And thank you so much once again, and have a great night. Thank you.